All right. Well, I guess the others will just have to join us as we go here because I know we all have very busy lives and cut out an hour to be with me tonight. So thank you so much for doing that. Tonight, we're going to talk about gut health. Tummy pains, bloating, and more is the topic. And I am very excited to share all of this information with you. I hope that you find it helpful. We're going to go through the presentation, and then at the end, I am going to do some question and answer. So if there's anything that you have a question about, write it down, put it in the chat, whatever it may be. And then at the end, I will address those things. So, all right. So to start here, a little bit about me. My name is Lindsay. I'm a physician assistant, and I've worked in orthopedic surgery for many years. And during my time there, I kind of felt like I was working on this conveyor belt of stick them, wrap them, stack them, throw them out the door. And as I was doing that, I was realizing that people had a lot of more complex symptoms than what we were always treating. People had a lot of inflammation of their whole body, things that we couldn't really help, and we had to send them to a rheumatologist. And as I would sit and talk with people about these things, I realized that they weren't being educated on their diet, their lifestyle, different things that they're doing every day that was maybe leading to this inflammation that they're having. And so I started to think, what's underlying a lot of these things. And as I was also seeing patients, I was seeing that a lot of patients were on the same medications. They're all on thyroid medications, all on cholesterol medications, blood pressure. I actually had a patient come to me one day and say, you know what, I was just at lunch with 10 women and 7 of them are on this thyroid medication. Why do you think that that is? And I couldn't tell her. I didn't know. And that really got me scratching my head. Why are so many patients on these medications? Why are there so many diabetics? What are we doing every day, or what are we not doing? And so I started really looking at what real health is. Is it just eating right? Is it just exercising? Or is there more to it? And so I fell into functional medicine, which is the study of root cause medicine, looking at the root cause of symptoms as to why someone maybe having all this inflammation, instead of just treating the symptom, what's underlying there. And as I fell into functional medicine, I started to study it. I started to learn more about gut health, and I realized that gut health is really foundational in our health. We have an immune system in our gut. Our gut and our brain connect, and we'll talk more about these things through the presentation. But I decided this is where my focus was going to be. And so that's what I'm specializing in at this time. And that's why I decided to do this webinar tonight, to inform you guys a little bit about some things that might be going on with you and things that you can maybe start to do to take back control of your health. Before we get started, I do have to do a little disclaimer here. This is just for educational purposes only. I am a licensed practitioner, but none of this is medical advice. I'm not trying to treat you or diagnose you through this presentation. I'm more than happy to talk to you after the presentation about any questions you may have, though. What we're going to learn tonight, how the digestive system works. So before you can know what's happening to you and where things are breaking down, you need to know how it's supposed to work. So we'll go over that. Symptoms related to underlying GI dysfunction. So common symptoms that a lot of people are living with that aren't normal, and some that you might not even associate with being a symptom that's starting in your GI tract. Different tests that I do to dig deeper into the root cause of your symptoms. And then lastly, why your favorite pair of skinny jeans just don't fit at the end of the day. So first, we're going to talk a little bit about the digestive system. I'm going to assume most of you have not taken in-depth anatomy classes. So if this is below you, I'm sorry, but we're just going to go through this real quick. So the digestive system is one big tube. Things come in one end and they go out the other, as we all know. And as we put food in our mouth, we chew it, right? And it comes down into our esophagus. But really, before it ever starts to come down your body is already making saliva, which has amylase, which is a enzyme that breaks your food down. So that's actually why you start to salivate before you even start to eat. Your body's preparing to start digesting this food. And then you put the food in your mouth and you start to chew it. Very important that you chew your food so you can start that process of digestion for your body. Unfortunately, a lot of us don't do that. We just shovel the food in our mouth. Then the food comes down into your esophagus and lands down here in your stomach. And in your stomach, it's actually kind of like a witch's cauldron of high of stomach acid. And this acid has to be at a certain pH. It's actually a low pH, like battery acid. And this breaks your food down, right? And if it's not breaking your food down, then that food sits in there, it starts to rot, and that's when it starts to come back up again, and you get reflux. After the stomach is done with the food that it's broken down, it releases it down into your small intestine. It's like the spaghetti here. And in the small intestine, that is where your food starts to break down further and your body starts to pull the nutrients out of your food. It's a very important step in your digestive process and where we get those nutrients from that go into our bloodstream and feed the rest of our cells. And then the food continues into your large colon here. And your large colon, it continues to pull out water, bulk up the remaining of the food. It makes it into stool, and then it pushes it out the other end. These are little accessory organs that help in this process. You have your liver, which does lots of different things. We could do a whole webinar on that. But one of the things it does help with is making bile, which is a juice that helps break down your food further. And then you also have your pancreas that also has enzymes that it releases into your intestines to help break down your food. So what happens when this isn't working how we want it to? So first off, if you have, you're supposed to have a certain pH in your mouth to help break down that food. And if you don't, and the pH is off, you can get ulcers, you can get canker sores, you can get thrush, which is an overgrowth of yeast in your mouth. Then if it's going down into your esophagus and into your stomach, but like I talked about, if it's not getting broken down in your stomach correctly, then it starts to rot, and that rotting actually makes more acidity and gases, and that's when you get that reflux that comes up. And you can get injury to your esophagus, changes in here. You can get ulcers in your stomach if the pH isn't right. And then that food goes down into the small intestine like we talked about. And if the food is not moving through your small intestine, like you have constipation and it's sitting in there, you can get different bacteria into your small intestine. One diagnosis we'll talk about is called SIBO, or small intestinal bacteria overgrowth. And really, there's not supposed to be a lot of bacteria here in your small intestine. And if they get in there, they start to eat the food that's not moving through, and then you get more symptoms, which we'll talk about. And then the food goes into your large intestine. And again, all of this is supposed to move through you smoothly, right? But if you have constipation, it's not moving through you, the food is sitting in there. You can get diverticulitis or diverticulosis, which is a very painful condition to have, where you get outpouching in the intestinal lining, and the food gets stuck in there and starts to rot. And then also in the large intestine, you can have different autoimmune disorders like ulcerative colitis or Crohn's disease as well. So what are some of these common symptoms that patients or people have that we're thinking that they're common, and this must be normal, but just because something's common does not make it normal. We say that a lot in functional medicine. And some common symptoms that I see a lot of people have, I've had in the past, that I've just decided, this must be something that everyone has and we live with, would be, bloating, gas, belching, diarrhea, constipation, cramping, acne, brain fog, hair loss, moodiness, nausea. These are all things that can be related to the breakdown of our system when it's not working correctly. And we'll go into why this happens more. And why do a lot of people get these common symptoms? Stress is a big one. So when we're stressed out, our body is not in rest and digest after we eat. And your body will not start to digest your food correctly if you're stressed out, because you have the vagus nerve that connects your brain to your gut. And it knows if you're stressed, and it thinks that you're running from a tiger. Really, that's how we were designed, that if we're in our sympathetic nervous system, that is our fight or flight. And it's not prioritizing digesting your food. So stress is a huge one that'll slow down your digestion and cause constipation. Stress will also lower that stomach acid in our stomachs. I talked about earlier that you need a really low stomach acid, like a battery acid pH, to break down your food. Well, unfortunately, stress will continue to make that go up, and not be so acidic, and that makes it difficult for us to break down our food. Another big one is our food, the food that we're eating every day. I think it's kind of funny that um, it's called the SAD diet, or the standard American diet, is actually something that we do talk about, and it's just over processed foods that our body does not know how to break down, causes a ton of inflammation in our gut, and can lead to difficulty with digesting our food. Reduced digestive capacity. This is because so many people are reliant on Tums or Prilosec because they have that heartburn and indigestion, and they're just popping these medications that's actually causing the underlying root cause to become worse. Infections are another big one that can mess up our digestive system. Food poisoning is a big one that, you might have those acute symptoms. You kick it, you start to feel better, but you may still be retaining some of those bad bugs in your gut that are causing underlying disorders. Dysbiosis, which we'll talk about a little bit more later, is an imbalance of the different microbes in your gut, which are your good bacteria that are there to help fend bad guys off. And they also have their own jobs. And if they're out of whack, and maybe one is really high, one's really low, this is called dysbiosis, and that can cause constipation, diarrhea, cramping. And then lastly, I wanted to throw in thyroid dysfunction. This is something that sometimes gets overlooked. If you have thyroid or hypothyroidism, that can cause your body to not digest food as quickly, and can cause constipation and some of these other symptoms.
Such a brat.
These are just some studies that I wanted to show you guys, that I found very interesting in relation to the gut and how it reacts with the rest of our body, or interacts with our body. This particular study is called the gut microbes effect on the mental health and the gut-brain axis. So again, we have studies that are showing that our brain and our gut are very closely connected, to the point where they're doing studies on mice, where they're taking maybe they have a mice that's from a certain lineage that's more of like a timid mouse, and then one that's more of an outgoing, bold mouse, and they flip their gut microbes, and it actually changes the personality of the mice themselves. They're showing that people that have depression, taking probiotics is showing like increases, or helping with their depression. And so this article is really interesting to show that connection of how important our gut microbes are in our mental health. This other one is the gut microbe and obesity. So again, this was a study on mice where they took a mouse that was a little chubbier and then one that was skinny, and they actually flipped their gut microbes and inoculated them, and the fat mouse became skinny and the skinny mouse became fat. And so we're even seeing this in humans now, where there's a certain microbe called Akkermansia, and we'll talk about this later, but Akkermansia is now being linked. It makes GLP-1s, which are those medications like Wegovy and the other weight loss injections that people are taking, they target that. Well, you have a microbe in your gut that actually does that. And we're seeing that when people are obese, that this microbe is actually very low, or this bacteria is very low in their gut. And then this last one is talking about the interplay between the gut microbes and the immune system and how important our gut microbes are in our immunity. There's actually a test that we can do that shows how your immunity is in your gut. And it's interesting to see in different people how low it really is, and how important, nutrition and diet is with keeping up the immune system in the gut. So to go back and dive in a little deeper on some really common problems that people are walking around with, I picked out just a few because I wish people knew more about these things, and I don't think that their doctors are telling them enough. The first one is heartburn and indigestion. I think people have it mixed in their brain that they think that if I have heartburn, that must mean that I have too much stomach acid. And acutely, yes, that is the problem. And then you take the Tums and the Prilosec to try to get that to go down. Unfortunately, the root cause of it is that you do not have enough stomach acid. So if the pH in your stomach is too high or alkaline, more like milk, then it's not breaking down your food. And the problem with this is that if it's not breaking your food down, then you're not able to extract the nutrients from your food. You're not able to get that food through your digestive system in a smooth manner. You get the constipation, and you get like fatty stools because you're not breaking down the fats and you're not getting that protein out of your fat. It's actually interesting here, interesting point that if you do not have stomach acid that's high enough to break protein down, you can actually, a lot of vegetarian and vegans have this problem and they actually get turned off to the smell or the taste of protein because that's a natural way of their body telling them, we can't do this. You can't eat that because if you do, I don't know how to break it down. I don't have the acid to do so. And I thought that was very interesting. Why do we care so much about this? Number one, like I talked about, the nutrient deficiencies that people are having, not breaking their food down. Number two, it can lead to constipation and bloating. It can lead to embarrassing gas or belching. It's very uncomfortable. It's very painful. And why do people have their stomach acid go up over time? Old age, as you age, your stomach acid actually starts to become more alkaline. PPI use, which is like omeprazole or Prilosec, these medications that we take all the time, not thinking twice about it, actually hurting us in the long run, and not to mention a lot of other side effects that they carry. Infections is another big one. There's actually a bug called H. pylori, which is a bug that can live in your stomach, and it actually lowers the pH of your stomach acid. So it can live there. It likes that. And unfortunately, 50% of Americans are walking around with this bug and they do not know it, and it's affecting their digestion. Chronic stress and autoimmune diseases also can cause a decrease in your stomach acid. Another big one I hear all the time is constipation, bloating, and gas. So many people are constipated, and I don't think that a lot of people know exactly what the definition of constipated is, but it's if you're having less than 3 bowel movements a week. And functionally, we would like to see people have a bowel movement daily, or at least one a day, if not more. And why? That's how we get rid of our toxins. Urinating, having bowel movements, that is how we clean our body out. And so if you're not doing that, your things are building up, right? Common causes of this, again, low stomach acid is a big one. Dehydration, dysbiosis. Another one I want to talk about is lack of digestive enzymes. So your body makes these enzymes in your pancreas and your gallbladder, and they go into your stomach and they help break down your food and your starches and your protein. And it's very common that people do not have enough of these digestive enzymes. And we see this on tests that we do. And so there are supplements that you can take to help with this. Another big one is what we call the MMC wave. That's your migrating motor complex. And what this is actually a neural conduction through your intestines that squeeze your intestines and help push your food through your intestines to the other end. And this can be interrupted for many different reasons. One is stress. Again, I talked about this in the beginning. If you are not in a relaxed state and you're rest and digest when you're eating, then this isn't going to work because, again, it thinks that you're running from a lion and that it does not need to digest your food right now. We have bigger problems. Another reason that this can be disrupted is constant snacking throughout the day. This takes about 90 to 120 minutes to really kick in and start to work. And it lasts for about 2 to 3 hours. And so if you're not giving it the time to do that, because you'll shut it off if you eat a snack, it shuts it off, you're not getting that MMC wave to push things through. Other reasons that this can be interrupted is if your vagus nerve, we talked about the nerve that goes between your brain and your stomach. If there is some type of brain trauma that affects the vagus nerve, or you have dysregulation of this vagus nerve, it's not working well, then the MMC wave isn't going to work well. And we'll talk more about how to get this working better in the end. Ooh, we didn't want to do that. And the last one, common symptoms that I think a lot of people are unfortunately walking around with that they don't relate to gut issues is depression, brain fog, and anxiety. I have to say, this was me for a long time with the brain fog, and I didn't know where it was coming from or how to even get a handle on it, and how do you even complain about that? You know, what is anyone going to do about brain fog for you? Not be able to find your words when you're speaking to someone becomes very annoying. And this can all be linked back again to your stomach. We're actually finding that 80 to 90% of your body's serotonin, your happy hormone, is made in your gut. Again, tryptophan, which we get from foods, helps serotonin be made in your gut. If something's off and that's not working well, this can lead to depression, anxiety. I know for me, if I eat a certain food, sometimes I will get anxiety, and you're like, how is this linked? It's all because the brain and the gut are linked so closely. We're also learning that, leaky gut, which is when the intestinal lining of your gut starts to break down from inflammation, and bacteria and food particles that are undigested start to leak out, and they get into your bloodstream, and they can go up into your brain, into your lungs. And there's actually, terms like leaky gut or leaky lung that can actually happen. And all of these things, again, linked back to our GI system. So to go into some more real diagnoses that we see, a big one that most people have heard about is irritable bowel syndrome. And irritable bowel syndrome basically is kind of like this umbrella term that patients get, unfortunately, when they go to the doctor and they have cramping, abdominal pain, bloating, gas, diarrhea. It can be a mix. There's irritable bowel that's more constipation, there's irritable bowel that's more diarrhea, and then there's a mixed type. And this can become very, very hard for patients because it starts to take over their lives. I mean, you're driving down the road, you have to pull over on the side of the road to go to the bathroom, or you have to plan your trip knowing where there's going to be bathrooms. Or maybe patients don't want to plan to go out and do things because they're not feeling well and they're scared that they might be stuck in the bathroom all night. And unfortunately, there's not a ton of good treatments for IBS, and patients are living with this. And now we know that 60 to 85% of patients with IBS actually have small intestinal bacteria overgrowth, or SIBO, which is something that we can treat. And so it's very exciting, and it's actually becoming more mainstream in with GI doctors, that they're actually looking for this now and trying to treat it as well. And so what is SIBO? So we talked about earlier about the small intestine, and there's where your nutrients are, excreted from the food that you've eaten and goes into your bloodstream. And in there, in the small intestine, you're not supposed to have a lot of bacteria. But if you're constipated or if you've had food poisoning for some reason, you can get these little bugs that are actually in the small intestine where they're not supposed to be. And when they're in there and there's food in there that's not digested, they start to eat the food and they have hit the Vegas buffet. They are excited to be there. They are eating all the food and they are tooting. And as they're tooting, they are making gases in your small intestine. And that's why throughout the day, people that have SIBO, it feels like their stomach is getting bigger and bigger. And by the end of the day, those skinny jeans just don't fit anymore. They can't button their pants. And this becomes very, very painful for patients. It also ruins the lining of the gut. It causes leaky gut. It causes a difficulty in a lot of food sensitivities because the gut is so reactive. Um, and it can cause other symptoms that it's very hard to get a hold of for patients. But good news is we have a test for this, and it's called the SIBO breath test. And what this is, it's you have a certain diet you have to be on, and then you get this drink that you drink, and it's full of all the things that these little bugs love. And after like an hour or so, you breathe into a bag, and then you do that a couple more times, and you send this off to a lab, and the lab actually measures how much methane or hydrogen or mixed gases that you are breathing out. And this lets us know what little microbes are in there that shouldn't be and what we need to target. So I'm craving sugar like there's no tomorrow. I have brain fog. I'm always tired. My skinny jeans don't fit me. If this sounds like you, then you may be dealing with candida. So this is another big diagnosis that we see a lot in functional medicine. That's an underlying bacteria in our gut. A lot of women are very familiar with candida or yeast, with yeast infections. And this can also be in your gut. And these little guys are very complex. They know how to transform themselves, so you can't get them with certain antibiotics or antimicrobials. They know how to make you eat the food that they want. So these little guys, they feed off sugar. Yeast loves sugar. And so it wants you to eat the brownies and the cake. It wants you to eat that processed food, anything that's high in carbs, because that breaks down into sugar. And so if you're like one of these girls here fighting over the last piece of cake or the chocolate at the end of the night, this just might be what you have. In addition to this, the yeast in the gut can cause a lot of other symptoms that are related. Eczema or skin rashes, it'll start to present on the skin, as our skin's our biggest organ, and it'll start to present there. It can also present as dandruff or acne. It can make you have mood swings because these intense cravings. And why do people get this? So common causes would be antibiotics. We know a lot of times when we get prescribed antibiotics, the doctor may also prescribe you something to kill off yeast, another antibiotic. And that's because you wipe out all the good guys, then those opportunistic bacteria like yeast are able to come in and take over. A bad diet again, high in sugar, high in carbs. These guys love that. You give it to them, they're able to proliferate. Dysbiosis. So we'll learn a little bit more of this on the next slide. But again, dysbiosis is when you have your good microbes that we want there, either low or really high. And if they're low, they can't fend off the opportunistic bacteria that want to come in and take over in the gut. And then lastly, poor eradication from previous infection. This can be really hard to get rid of. And unfortunately, if you go back to eating the carbs and eating the sugar, it can come back quite easily. There are some other tests. We're going to go through some tests now that we use in functional medicine. One I didn't mention would be we have one called the oats test or the organic acid test that actually looks for yeast. And that's like more of the gold standard. But then we also have the GI map. And so we're going to go into a little bit about the GI map. The GI map is a functional medicine test that basically takes a snapshot of your gut. It's a stool test that you do at home on your own in the comfort of your own home. And it gets sent out to the lab. And this is what the results look like. I didn't show all of them because it would just be too much to go through tonight. But you can see over here, this is the commensal or keystone bacteria. So this is the bacteria that we want to have in our gut that are good to have there. And you can see this particular patient had a lot that were really low or almost missing. And then a couple that are high, only a couple in the green. So normally we want to see all of these in the green. You can see the Akkermansia here. This one is the one I talked about earlier that's related to weight loss. This patient actually had his in the green, and so that's good. And then you come down to like over here, we have protozoa or worms. This particular patient did have a protozoa actually present. And these you can get through contaminated water, contaminated foods. And a lot of times they're able to live if you don't have good digestion, if you don't have the stomach acid to kill them off, they're able to stay in your gut and proliferate. I think this one's really interesting, the Endolimax nana. This one, if it is present, it's actually related to joint pains. It's interesting to see when a patient actually has this present and they do have complaint of overall just joint pain and dysfunction, it can be linked back to this little guy here. Down here, the intestinal health markers. So your steatocrit and your elastase, these are the enzymes that you need to break down your fat, your proteins, the starches. And so if you're not making enough enzymes, these will be off. And those need to be, substituted for in your diet. Occult blood, will test to see if there's any blood in your stool. Most of the time there's not. The SIG-A marker here, this actually is looking at your immune system in your gut. And as I said, a lot of people, it's very low. The most common reason for this to be low is stress. We know that stress lowers our immune system. It works off the cortisol, and the cortisol, if it's high too long, you will get the result of having difficulty with your immune system and fighting things off. And we see that here on a lot of people. Anti-gliadin, this is actually a marker that shows any reaction to gluten. This is not the gold standard test. This is not what we use to diagnose celiac disease, but if someone is having reactions to gluten, this will be high here. Eosinophils, that's if you have any allergies going on or allergic reactions in your gut. And then lastly, at the bottom, we have the calprotectin, which shows inflammatory markers and how much inflammation is in your gut. On this other page, these are the opportunistic bacteria that I was talking about. These are the bad guys that we do not want to see, but they will come and they will start to take over in our guts if we don't have the good stomach acid present, and or we've had an infection for some reason, or we're constipated, those kind of things. These guys will start to grow. This particular patient actually had a complaint of a lot of loose stools and urgency, and the streptococcus was actually high, which is interesting because this is one of the bugs that cause loose stools. So, as you start to think about your symptoms and you get these results back, it's cool to put the two together and really see how they work. These are really interesting. These are inflammatory and autoimmune related bacteria. A lot of these are related to rheumatoid arthritis, Sjogren's syndrome, ankylosing spondylitis. These are all big autoimmune conditions. And I was actually just reading some studies yesterday that were showing that they're taking patients that have these diseases and doing tests on them, and their levels are much higher than you'd see in a normal person, or even someone else in their family that does not have the disease but has their same type of genes for autoimmunity. Well, the patient that actually has the symptoms and the autoimmune disease will have higher levels of these. Um, so this GI test. This is the main test that I usually do on patients if they're having diarrhea, constipation, even brain fog, um, or even autoimmune conditions. It's really great to do this test and see how they're breaking their food down, how much inflammation is in their gut, do they have any bad bugs in there, how do their good bacteria look, do we need to work on that. So I love this test. This is one of the main ones that I like to order. So throughout this presentation, I talked a little bit about leaky gut, and I just wanted to talk a little bit more of what that means. And so what it really is, it's gut hyperpermeability, which means that the lining of the gut should be nice and tight. So you have your little cells here, and they're all nice and tight, and they're holding on to each other, and they're only going to open up and let through the good stuff that they want to go out into your bloodstream. So all the good nutrients, they'll let that through. But if we have chronic constipation, if we have food allergies, autoimmune disorders in our gut, if we're eating a poor diet, the gut lining starts to break down, and these little junctions that are holding together, they start to open up. And when that happens, the bacteria that's supposed to go out the other end starts to get into our bloodstream. The undigested food that's supposed to go out the other end, it starts to get into our bloodstream. And that's when it starts to go into our bloodstream and go to our brain, go to our lungs. And this can cause all types of different symptoms. Like I talked about earlier, that gut-brain connection, you can get depression and anxiety. You can have Hashimoto's or Graves' disease, which is an attack on your thyroid. We're linking that back to a lot of food allergies and gut inflammation, fibromyalgia, headaches, brain fog. They're actually even linking leaky gut to ADD and ADHD in children. So important to look at what you're feeding your kids, the quality of the food. Processed foods are just going to cause inflammation in the gut and cause these little junctions to open up and lead to rashes. A lot of eczema we can lead back to the gut and this leaky gut. And there's actually a test that we can do. It's called the ABA test, or the Advanced Intestinal Barrier Assessment. And this actually looks at different markers of your gut and looks at how, if the gut is breaking down. So if these little junctions are breaking down, then like zonulin here is one of the proteins that help hold the junctions together. If it starts to break down, this will be really high. And so we can use this test to look and see, does someone have leaky gut? Most of the time, I don't order this test. It's something that we could if someone really wanted to know for sure. But by looking at someone's GI map that we just went through, I can kind of deduct from the inflammation they have on there, the symptoms they have on there, whether or not they're dealing with leaky gut symptoms. So what do we do? What do we do if we think that we have some of these problems? What are some things that we can do at home on our own, or what do we do from a medical standpoint? So heartburn, indigestion, and reflux, things that you can do at home to start with. Number one, chewing your food properly. So every time you eat, you really want to chew each bite. I want to say for like 10 chews. Really break it down. That's really going to get your digestive juices flowing and get that food broken down for your body to be able to digest it. Get into rest and digest. Again, we're talking about that vagus nerve. And the fact that if your body thinks that it's running from a lion, it's not going to want to digest your food for you. So, things you can do to get into rest and digest. You're sitting down to eat a meal, and you can rub your eyes like a little kid before they go to sleep. That's a natural way to kind of get your body calmed down. You can say a prayer before you eat. If you're not religious, you can always do like a gratitude, like go around the table and say something that you're thankful for, or a win for the day, or something like that. Another big one is not drinking water with your meals. When you drink water with meals, it actually lowers your pH in your stomach, and you're not able to break down your food as well. Obviously, avoiding trigger foods. So, citrus, tomatoes, peppermint, chocolate, these foods, alcohol, these foods are obviously going to cause irritation in your gut lining. Lastly, you can try a supplement called betaine, which is a supplement that actually helps make your stomach acid more acidic. Now, this isn't for everyone. I do not want you to just go buy this and do it on your own, because if you do have heartburn or indigestion, this can make it worse. Or if you have H. pylori, that bad bacteria we talked about earlier that can live in your stomach and cause some of these symptoms, you don't want to take this right away. We need to treat that first. But that is an option, and it's a more natural way long term to get your stomach acid back where it needs to be and get people off of depending on the Tums and the PPIs, for a lifetime. A lot of people are on those for a lifetime. Constipation, gas, and bloating. So, what can we do to help with this? Help with your stomach acid. So, what I just talked about, all those things I just talked about, getting that stomach acid back up. Some tricks are, having apple cider vinegar before a meal, or bitters before a meal can help with this, to help increase the stomach acid before you eat. Walking after meals is great for constipation. Just in general, any physical activity is going to help get things moving. Fiber, fat, and protein in every meal, very important. Your body needs the fat and the fiber to make your digestive process work. The fat to help get things moving smoothly. So healthy fats like avocado, olive oil, avocado oil, butter. These things help. Those are good fats that you can eat. Hydrated, your body needs to pull in water into your gut. So you need to stay well hydrated. We already talked about rest and digest. Again, that helps with, a lot of these are overlapping. Digestive enzymes are another big one. So if your body's not making digestive enzymes through your pancreas, and not dumping those into your intestines to help break down your food, then there's supplements that we actually have that you can take before a meal to supplement for that and help break your food down. You may know that you need these if you have a bowel movement and your stool floats. Not good. Or if you see undigested food in your stool, or the stool is more of like a yellow color than a dark color. These are all can be signs that you're not breaking your fats down. And meal spacing. So this is another one. We talked about the MMC wave. So that's the wave that helps squeeze the food through the digestive system. And you need to space your meals at least 3 to 4 hours apart, so your body has enough time to let that system work, that MMC wave go all the way through, and push the food out, your stool out. Patients that have SIBO, or that small intestinal bacteria overgrowth, this is definitely something that you need to see a practitioner for. This is going to take a very stepwise approach to get to the bottom of it, along with the candida. There's certain diets that you can try that can actually help you diagnose yourself at home. So that is something you can do at home. One's called a low FODMAP diet, and you can look that up. And that's basically taking foods out of your diet that are hard for you to digest. In addition, like garlic and onion, usually if someone has SIBO, this is going to be very irritating to them. So cutting that out. So you can look up a low FODMAP diet, try to follow that and see if that helps. With the Candida, a no sugar diet. Unfortunately, there's sugars in so many things, from spices to sauces. It's a really hard diet to follow, but really worth it if you're having any of those symptoms of the brain fog, or the bloating. You can really start there. And then, in addition to that, from a functional standpoint, we work on repairing your gut, because if you have these conditions, there's been a lot of destruction in your gut already. We need to repair the gut lining, heal that leaky gut, get that immune system back up. And then we start to kill off these bad bacteria that we don't want there anymore. And then we'll re-inoculate. Then that's when the probiotics and that stuff comes in. This is a little handout that I give to patients. It's called Waking Up a Sluggish Colon, and I'm happy to give you one if you like one. You can, find me on Instagram, Facebook. You can email me, whatever you'd like. But this is basically kind of like a step-by approach of how we go down in treating constipation for patients. So, first we look at the nutrients. Are you getting enough of that water, fiber, and fat? Then we look at your stomach acid. How does that look? Is that, do you have enough stomach acid to be breaking down your food? Looking at, are you chewing your food? Are you doing meal spacing? Are you eating on the go? That's another big one. You're not going to digest your food if you're eating in your car, driving down the road in crazy traffic. Your body's not concerned about that at that time, unfortunately. Or eating standing up because you're doing a million things, right? And then we go to hormones. Do you have too much cortisol? Do you have low thyroid? Are these reasons that maybe your body is not allowing that MMC wave to work? And then we look at the bacteria. Do you have, history of the food poisoning? What are we working with here? And then we continue to go on. These are some of the things I just talked about, things that you can do at home to help treat constipation. And then lastly, I just wanted to talk about this functional medicine wheel. So today we focused a lot on the gut and gut health and ways that we treat that. But you heard me talk about, getting out and getting active and moving, emotional and stress, managing stress, looking at your nutrition. So, from a functional medicine standpoint, we try to be more full body, full person from every aspect of their lives, because we know that every aspect of our lives affects our health. From our relationships with our friends and our family, that can cause stress. There can be trauma there. All of these things can influence our health, not just our gut health, but other things. So from a functional standpoint, we'll break these things down for you, looking at your stress, looking at your emotions. Do you need to detox? Most of us do. Are you exercising? How are you sleeping at night? That is another huge thing from a functional standpoint. We know that the body does so many things at night, really cleans out the lymph in our brains. So important to get that 6 to 7 hours of sleep at night. And then we go into, what supplements and nutrition may be needed. So this is the holistic standpoint. So if there's some key takeaways I could give you tonight, GI symptoms are common, but they're not normal. Just because all of your friends are dealing with the same thing doesn't mean that that's normal. And it doesn't mean that there's no root cause that can be addressed and get you feeling better. And I can tell you that for myself. And the GI system is the foundation of our body's health. We talked a lot about, how the gut relates to the brain. It can relate to autoimmune conditions, stress, all of these things can affect it. But really, when anyone comes in with really any type of symptoms, a lot of times we like, from a functional standpoint, like to start in the gut and build from there. And then lastly, if any of this interests you and you want to know more, you want to talk, I'm happy to do a free 30-minute consult with the first 5 people that sign up. Usually I just do 15 minutes, but if you came tonight, I'm happy to do 30 minutes. That little QR code, you can just scan it and make an appointment. And we can kind of dig deeper into whatever symptoms that you might be having, and see if there's any way that I might be able to get you feeling better. All right, so now I'm going to open up for any questions. So if anyone has any questions, you're more than welcome to, jump off mute and ask any questions you may have.
Well, um, yeah, I have some of the issues and I need to get to the bottom of them.
Okay.
Yeah, I
I
do.
would love to talk to you if you want
Yeah,
to make a little consult. We can
yeah,
chat and see what's
yeah,
been done already,
yeah.
what things I can look at for you, or what we
Okay.
might need to, dig deeper into.
Yeah, because I'll be down in Florida. I mean, we can do this. And who do you work for, Lindsay?
I actually work for myself.
I love that. Okay.
Yeah.
Okay. Okay. Cool. I'm in.
Yeah,
Yeah.
so
All right. Yeah.
awesome.
Okay.
Well, I'll either contact you or you're more than welcome to, I guess if you're on your phone, you can't really scan the QR code because you would need your phone to do that. But um, I'm happy to send you the link
Yeah.
so we can talk more.
Yeah.
Awesome.
Good.
All right. So anyone else have any questions this evening?
I have a question, Linz.
Oh, yes.
Um, like some of the, I guess what you're saying that people have like SIBO or you have this or
Mhm.
you have that or we think you have this type of thing. Like, do those all have like a specific test that you can take to really be like, yep, you have this? Or is it just based off of this GI map? We think you may have this, so we're gonna do XYZ and see if it works. Or is it like, since we think you have this, we're now gonna take this test that tells you that you have it? Like, is that how it works with all of these things or some of these
Yeah.
things?
So usually, I mean, we'll start with the GI map, and there's certain markers on there, like four, that would indicate someone has SIBO. And so if those are high, and there's other findings on the GI map, certain bacteria, um, we'll kind of deduct that someone has SIBO and treat that. If we wanted to know for sure, then yes, there is a specific SIBO test. But to kind of save patients money and having to pay for those tests, a lot of times we'll just treat it as if it is SIBO because we see all the other signs of SIBO on the GI map and with the patient's symptoms. Same thing with the Candida. Um, Actually, Candida there's actually a questionnaire that someone can do to see if they have Candida, and it's actually very
Hmm.
accurate. And yeah, so it's just a questionnaire. It's like 40 questions, but at the end you get a score. And if you have a high enough score, that can indicate that someone has Candida. And it's been shown over and over again. It's actually a very accurate questionnaire to diagnose someone with Candida. But there's also the oats test, which is a urine test that will look for Candida in the blood or in the urine and in the system. And that one's pretty specific as well.
Okay, that makes sense.
Yeah, so we kind of, I mean, trying to save money, we try to go for like look at your symptoms, look at the GI map, put it together and treat it. But yeah, if we want to get more specific, we can.
Well, also the perks of going functional medicine over regular doctors because they're just gonna be like, yep, you need this test now and this test now.
That's true. And then you get sent for all of the tests.
Yeah. You're like, okay, I'm broke now. I don't want to do it anymore.
Exactly. So yeah, we try to be cognizant of that.
Lindsay, I don't know if you can even answer this question considering there's so many variables in this, but is it even possible to kind of give a rough estimate on like beginning to end for a new patient to come in, take the tests, and then make the changes before you kind of start to see the body making the adjustments? I mean, what is it even possible to give like a rough idea of what you would expect for a new patient to see the return?
Okay, well, that is a good question. I would say if someone was really dedicated and they really followed like the diet nutrition plan, for like say SIBO or the Candida, they're gonna start seeing symptoms change within the first month. Because if you're eliminating the foods that aren't causing the irritation or we're killing off that yeast that or starving that yeast, you should start feeling better within the first 4 to 6 weeks. But it depends on what we're working with. If we're just talking about gut health, I would say in regards to that, most patients should start seeing some results within a month to 2 months. But to really treat these things, you might be feeling better, but to really eradicate these bad bugs, that can take, and to heal the gut, that can take a couple, like 2 months just to kill off the bad bugs. And then it can sometimes take 6, 8 months, sometimes a year, depending on how long someone's had a condition, to really heal the gut and get them back to their like homeostasis, or where they were supposed to be to start.
Okay. So as far as improvement, that's quick. Solution, obviously longer.
Right.
Okay.
Question.
Hello.
Hi. Um, what do you think about MCT oil powder and also cholesterol as supplements in your coffee in the morning?
I didn't hear the second one. You said cholesterol.
Cholesterol.
Oh, colostrum.
Colostrum.
Yeah, I think that's great. I mean, you obviously want high quality supplements. So you want to look and see, where they're being sourced from. But I love MCT oil, specifically for constipation. That's one that I do recommend to a lot of patients. I don't really love, um, what should I say? I'd rather them mix it with like tea or something like that. But coffee works as well, and it's really good for brain health. And it's also good for your blood sugar because you're adding in good fats. That's actually going to keep your blood sugar level longer. So you're not getting these spikes in your blood sugar, and it'll keep you fuller longer. So I love MCT oil. You just have to be careful to not overdo it, or if you have like high triglycerides, um, like on your blood work with your cholesterol, if that's high, sometimes you don't want to take too much MCT oil. Colostrum is great. That's really great for your gut health. That's good for repair of your gut lining. Again, if it's being sourced from a good source, and it's quality, then yeah, I think colostrum is a great thing to take. I think we could all use that for our gut health. And that's in a lot of the supplements that I recommend as well.
And how often it seems that a regular person, like myself, I consider myself regular, that at times you have, experienced gut problems, and then a week or so goes by and then everything's back to sort of normal, and then you might fluctuate different times based on, I guess, your diet or traveling or whatever. So how often should you get this test that you send away, stool sample?
The GI map, I would say like once a year. I mean, if you had the means to do it once a year, it would definitely be a good check-in on your health, to look at what your gut is looking like, especially if you've been working on your gut and you want to keep it healthy. I think once a year would be reasonable.
Okay, good answer.
And does that go along with a blood test as well, or just the when you take on a client,
Mm-hmm.
what do you usually have them to go through so that you can evaluate their health situation?
Yeah, so it definitely depends on the patient and what symptoms that they're having. Most new patients, or all new patients, I like them to have blood work done within the last 3 months. Again, because we want to look at their thyroid. What is there something going on with the thyroid that can be causing these digestive disorders? You want to look at, their blood cells. You want to see, are they anemic? Are they deficient in certain vitamins? So yeah, I always get basic blood work for most of my patients starting out. And then from there, I also deduct what functional test I want to do.
Okay, well, thanks, Lance.
And also, if
Another question.
if someone needs an antibiotic or other things, do you also are you able to prescribe medicine?
Mhm.
Yes, I can prescribe antibiotics if needed or other medications. Honestly, I just don't choose to. There's a lot of really good antimicrobials that we use, like oil of oregano is a big one that we can use to kill off whatever we need to. So that's usually not what I reach for, but if I had to, I could.
Thanks, Linz.
You're welcome. Anyone else? Any questions? We're all good.
No,
All
it's,
right.
it's really very informative. Yeah.
Oh, good. I'm glad you enjoyed it. I hope I
Mhm.
didn't talk too fast. I was trying to get through all the information for you guys.
Yeah, not good.
Awesome.
Smart.
Are you going to do
All
this on
right.
a regular basis, or is what's the schedule?
Yeah, actually, I'm gonna do this every couple of months on gut health. But my next one, stay tuned. I'm gonna be doing a webinar on a detox. We all really need detox for our bodies, just from the environment we live in, the food we eat. And so I'm going to be hosting a group detox in February, and I'm going to launch that with a webinar all about detox, and then go from there. So that'll be the next webinar to be looking out for.
Okay.
All right.
All right.
Okay, you guys have an awesome night. Thank you all so much for spending your evening with me, and I look forward to talking to you guys more.
Okay.
All right,
Yes.
bye-bye.
Bye.
Bye.
Good boy.
Bye.